హలో వ్యూవర్స్, వెల్కమ్ టు ఆరోగ్య భారతి. నేను మీ హోస్ట్ అపర్ణ. ఈరోజు మనం మెడికవర్ హాస్పిటల్స్ లో ఉన్నాము అండ్ ఇక్కడ మనతో పాటు ఈఎన్టీ సర్జన్ డాక్టర్ సంపూర్ణ ఘోష్ గారు ఉన్నారు. ఆవిడతో మాట్లాడదాం. మేడం నమస్తే.
అందరికి నమస్కారం. ఫస్ట్ ఆఫ్ ఆల్ థ్యాంక్ యూ అపర్ణ ఫర్ గివింగ్ మీ ద ఆపర్చునిటీ. నాకు తెలుగు మంచిగా రాదు బట్ నాకు అర్థమవుతుంది. సో ఐ విల్ ట్రై టు
మీరు
డూ జస్టిస్ టు మై తెలుగు ఆడియన్స్.
తప్పకుండా ఏదన్నా ఉంటే మన తెలుగు ఆడియన్స్ కూడా ఇప్పుడు అన్ని లాంగ్వేజెస్ అర్థం చేసుకోగలరు కాబట్టి ఇట్ ఈస్ ఓకే, నాట్ ఎ ప్రాబ్లం. సో యూజువల్ గా ఈఎన్టీ సర్జన్ అంటే మనం అనుకుంటాము ఓన్లీ చెవిలో ఇష్యూ వస్తేనే అనేసి, కానీ కాదు. ఈఎన్టీ డాక్టర్స్ అనే వాళ్ళు ఏమేం ట్రీట్ చేస్తారు అనేది మీకు తెలిస్తే మీరు చాలా సర్ప్రైజ్ అవుతారు. సో మేడం, మీరు ఒకసారి ఈఎన్టీ డాక్టర్స్ ఏమేం ట్రీట్ చేస్తారు అనే
సో
విషయం.
ఈఎన్టీ అంటే మూడు ఆర్గాన్ ఇక్కడ. ఈ అంటే ఇయర్, ఎన్ ఈజ్ ఫర్ నోస్ అండ్ టీ ఈజ్ ఫర్ థ్రోట్. సో బేసికలీ వీ డీల్ విత్ దీస్ త్రీ ఆర్గాన్స్ and there are various varieties of diseases. So the subject actually serves a lot of diseases like sinusitis, different kind of infection in the throat, tonsil problem, different kind of cancer in the mouth cavity, in the throat, tumors in the nose. These are the main thing. Other than that, chronic ear infections like you are getting cheem ostundi, kanni kanniki malli malli cheem ostundi, chevu noppi ostundi, vinikidi taggindi. So all these hearing problem, infection related to the ear, that is also tackled by ENT doctors.
సో ముఖ్యంగా ఈ రోజు మనం మాట్లాడుకోబోతున్న టాపిక్ వచ్చేసి స్నోరింగ్. ఈ గురక అనేది కామన్, అందరూ నిద్రపోతే ప్రశాంతంగా గురక పెడతాం అని అంటూ ఉంటారు కదా. సో అసలు గురక అనేది డిసీజా?
Yes, definitely. Like this is a myth in the society that people think, oh, he or she is sleeping well, that they are snoring. It is a deep sleep. It is a good sleep. It is actually not. It is actually opposite. So a person snoring means akkada obstruction unnai. Mukkulo or guntulo obstruction unnai. So if there is a obstruction, the airflow will be not good enough. There will be vibration here. This area is like a straw. If you imagine a straw which is for coconut water drinking, but you are trying to drink a mango juice, what will happen? The straw is narrow. It will get stuck, or the straw will vibrate. So this is how happens in the airway. If there are obstruction in the nose, throat, or if the person is very fat, lot of fat deposition here, so the straw, the air tube becomes narrow, and in the narrow tube, when you are trying to pull air, it starts vibrating and then it collapses. That is the origin of snoring. So snoring, definitely once in a week somebody is snoring. If the person is very tired or after a couple of drink, that is okay. But every night somebody is snoring, that is not normal. That is a disease.
ఓకే. సో కొంతమంది బాగా అతిగా గురక పెడతారు. ఎంత అంటే పక్కన పడుకున్న వారు నిద్రపోలేరు. కొంతమంది చిన్నగా ఈల వేసినట్టు, లైక్ ఇట్స్ లైక్ అ విజిల్. సో ఇలా డిఫరెంట్ సౌండ్స్ ఉంటాయి.
అండ్ కొన్నికి మొత్తం గాలి మూసిపోతుంది. సో దే హ్యావ్ అ చోకింగ్ స్పెల్ అండ్ దెన్ దే లైక్ దిస్, దే సడన్లీ, that is dangerous. That is called apnea. At that moment the person is not getting any oxygen. So the brain is getting a red signal, you are not getting oxygen, wake up. So they wake up, again they start snoring. It's like a cycle. So every snoring is not a disease, but the people who are getting those pause, getting this apnea, and the people who are having a morning headache, dull feeling after getting up. Lot of my snoring patient, I ask few leading questions, so immediately I can understand who needs treatment. Number one question is, are you happy when you get up in the morning? Most of this snorer will say, no, I don't feel fresh, I feel drowsy, I feel dull, something is heavy, varuga anupistunda. So these are probably bad snoring. Okay. You can see some people who are waiting in for me, and in the waiting lounge they're dozing. Or you get with them in a cab or in the flight, immediately they will fall asleep. Even in a movie theater they are sleeping. So this is called excessive daytime sleepiness.
Okay, daniki
that is relation. Exactly. So these people, if you inquire, most of them are snorer because at night they are not getting good amount of oxygen. their brain is tired in the daytime. They easily fall asleep in the office. And the dangerous people who are suffering for many years, they even fall asleep while driving.
Okay.
Lot of snoring patient or obstructive, the bad form of snoring is called obstructive sleep apnea, OSA. So many of the OSA patients meet road traffic accident because of feeling drowsy while driving.
ఓకే. సో బేసిక్‌గా గురక పెట్టటం వల్ల మనకి వేరే ప్రాబ్లమ్స్ ఏమొస్తాయి అంటే బ్రెయిన్‌కి ఆక్సిజన్ అందక బ్రెయిన్ టైర్డ్ అయిపోతుంది.
Correct.
ఇలా రెగ్యులర్‌గా జరగడం వల్ల ఇంకా ఇబ్బందికర
మెమరీ తగ్గిపోతుంది.
ఓకే.
కొన్నికి ఫ్యామిలీ లైఫ్ లో, పర్సనల్ లైఫ్ లో లిబిడో, సెక్స్ డ్రైవ్స్, ఎవ్రీథింగ్ కమ్స్ డౌన్. దే కెన్ నాట్ కాన్సన్ట్రేట్ ఇన్ ద ఆఫీస్. దేర్ పర్ఫార్మెన్స్ కమ్ డౌన్. ఇట్ ఈస్ లైక్ అ స్లో పాయిజనింగ్.
బాబోయ్! గురకతో ఇన్ని ప్రాబ్లమ్స్ we really don't know.
If you meet a good physician or a cardiologist or a diabetic specialist, so when they see that I'm giving medicine but BP is not coming down, I'm giving medicine but sugar is still high, they will immediately ask, do you snore? OSA is such a disease which does not allow to control the BP, which increases the sugar further.
Okay.
We have seen that treating the snoring or the OSA, the BP medicine dose has come down. Or a diabetic person who was taking insulin came down to a tablet. Okay. Or who was taking 3 tablets came down to 1 tablet. So treating the OSA actually gives reliefs to many other diseases.
ఓకే. సో ఇలా కూడా జరిగే అవకాశం ఉంటుంది కాబట్టి ఖచ్చితంగా ఎవరన్నా ప్రతిరోజు విపరీతంగా గురక పెడితే డాక్టర్‌ని కలవాలి.
Definitely.
అయితే ఇక్కడ ఈ మధ్య కాలంలో కొన్ని గ్యాడ్జెట్స్ వస్తున్నాయి. ఎవరైతే స్నోర్ చేస్తారో వాళ్ళకి ముక్కులో పెట్టుకుంటే స్నోర్ రాదు అనేసి. Did you see
yes,
ads?
got it. There are some nasal strips and all.
Do they work? Are they safe?
They're safe. There is no harm in that, but they're not specific. They don't work in a heavy snoring. Maybe light obstruction or few hours it may work, but that is not the proper treatment.
ఓకే. సో బేసిక్‌గా మీరు రెగ్యులర్‌గా ఈ ప్రాబ్లమ్స్‌తో వచ్చే వాళ్ళని ట్రీట్ చేస్తారు కాబట్టి ఇప్పుడున్న జనరేషన్‌లో ఈ గురక అనే ప్రాబ్లమ్ అనేది ఎంత పెరిగింది? ఎందుకంటే అన్ని డిసీజెస్
చాలా పెరిగింది. And nowadays the patients are coming below 40 because of lifestyle change. If you see, maybe few generations back, OSA or snoring was not such a big disease before, because people were physically active. Sedentary lifestyle is the main problem of many diseases like hypercholesterolemia, like diabetic, hypertension, obesity. Similarly, OSA is because of sedentary lifestyle. So if you see the world statistics or Indian statistics, you will see in the rural population the percentage is less. Maybe 5 to 7% of people have snoring or OSA. Urban population, that same percentage becomes 15 to 20% because we are not moving our body enough.
ఓకే. దీంతో పాటు ఇంకేమేమి రీజన్స్ అవుతాయి అంటే మనం ఎక్కువగా ఏసీలో ఉండి వర్క్ చేస్తూ ఉంటాము అండ్ అదొకటి అండ్ హ్యావింగ్ స్మోకింగ్ అనే అలవాటు ఉండటం వల్ల కూడా స్నోరింగ్ వచ్చే అవకాశం ఉంటుందా?
Yeah, AC one I'm not sure doesn't have a direct relation with the snoring, but yes, it may have allergic problem, asthma, these are increasing. For snoring, number one is if you have lot of fat in this area, especially the neck circumference, the tongue becomes thicker, automatically the airway becomes narrow. Number two is if somebody takes a lot of junk food, alcohol, doesn't do any exercise, slowly the muscle tonicity of these areas they reduce. So doing yoga, doing exercise, and doing some kind of it can be walking, badminton, some kind of sports activity improves the muscle tonicity, allows you to be in a good shape of body. That can prevent snoring. Other than this, there are some people who have polyp in the nose. This partition wall is deviated, bony bending, adenoid, big tonsil. That is a separate problem. They may not be fat, they may be physically active, but there is a problem in the nose or throat which is causing the narrowing. They need surgical cure. You need to remove that obstruction make the passage clear for the air, and the snoring comes down.
ఓకే. సో, యూజువల్‌గా ఈ గురక అనే ప్రాబ్లము మగవారిలోనే ఎక్కువ ఉంటుంది అంటూ ఉంటారు. ఇది నిజమేనా? ఆడవారు కూడా ఎక్కువగా ప్రాబ్లమ్ ఫేస్ చేస్తూ ఉంటారా?
Men are more affected.
ఓకే.
But after menopause, when the menstruation stops, then middle-aged ladies like 50s, 60s, then the percentage increases. Till a lady is menstruating, we have a definite kind of hormonal balance that keeps the snoring away. When that hormone goes down, so after menopause, they become like the percentage increases like the male.
ఓకే. సో, ఈవెన్ హార్మోనల్ చేంజెస్ ఎఫెక్ట్ స్నోరింగ్.
Definitely. If you see in your family, you will see that maybe grandmother or aunties who are little elderly, they snore a little bit, who never had snoring previously in the lifetime. So after menopause, mild snoring can come.
ఓకే. సో, అసలు ఈ స్నోరింగ్ అనేది మనం డెఫినెట్‌గా స్నోరింగ్ వల్ల ఇబ్బంది పడుతున్నాము, డాక్టర్ దగ్గరికి వెళ్ళాలి అని ఎలా తెలుసుకోవాలి?
Correct. Number one thing is how you feel when you get up in the morning. If you feel fresh, your daytime energy level is good, probably that is not a bad snoring. But if you feel tired, even after spending 7-8 hours in the bed, you feel morning your head is spinning, something is wrong, you want to lie down again, or here and there you are falling asleep. The family members will tell you. Oh, suppose everybody is there, they're chatting, another person is dozing. Then you know there is something wrong. Number two is if you are a diabetic person, hypertensive person, along with that you have snoring, then you must mention that to your doctor.
Okay.
There are some other symptoms, like some people tell me I have excessive sweating at night, or I get lot of nightmares, or I have a fragmented sleep. They get up multiple times, go to washroom, and they feel dryness in the throat. These are all symptoms of obstructive sleep apnea.
ఓకే. సో, చిన్న పిల్లల్లో కూడా ఇలాంటి ప్రాబ్లం ఉంటుందా డాక్టర్?
Yes, children also suffer from snoring, but their reason is different. Like adult, I told you sedentary lifestyle, obesity is major reason, whereas in children, big tonsil and big adenoid is most common reason for snoring. As you know, tonsils are there inside the throat, everybody knows that. Similar one structure is there behind the nose, where nose is ending and throat is starting. In that angle, there is a structure called adenoid.
Okay.
If the adenoid enlarges, then the airflow in the nose gets stuck. The air does not flow well. So there are a lot of kids who suffer from mouth breathing and snoring, which is absolutely not normal. That should be treated.
ఓకే. సో, ట్రీట్మెంట్స్ అంటే ఇప్పుడు ఏముంటుంది? ఇప్పుడు గురక అనేది మీరు చెప్పారు, ఇది ఏదైతే నారో నర్వ్ ఉంటుందో దాని వల్ల అవుతుంది అనేసి. దానికి ట్రీట్మెంట్ సర్జరీ.
Again, the children and adult will discuss separately. Children, if we see there is a big tonsil adenoid, we treat with medicine first, 5 months, 6 months, maybe 1 year, and do regular follow up with the parents. Is it coming down? Is the child breathing through nose now? If it is improving with medicine, well and good. Not improving, child is always, some children you will see, they sit like this, like a little bit forward posture, and mostly mouth is open. That is absolutely abnormal. Mouth breathing is not normal. We should breathe through nose and eat through mouth. So if this is not improving with medicine, we go for surgery in children. In adult, number one, when I counsel, if I see the BMI, how is the body mass index? If the BMI is more than 30, 35, 32, first half an hour I counsel for weight reduction.
Okay.
There are many patients who got motivated and who reduced 15 kilo and came back to me, snoring is gone.
Okay.
So number one in adult counseling starts from maintaining proper weight, doing exercise, having good lifestyle. Number two, I will do endoscopy here in my OPD to check the nose, throat, everything. If there is any structural obstruction, I will go for a surgery. And number three, there is a machine called CPAP. CPAP, if you put this, it has a mask and a small this size machine which is kept in the bedside. It is run by electricity. So if you put that mask and go to sleep, it will push some kind of air inside your air tube. So whenever the straw is going to collapse, the air goes and pump it open. It will never allow the pipe to close. It will never allow snoring to happen. So CPAP success is almost 99%.
కానీ అది కంటిన్యూస్ గా పెట్టుకోవాల్సిందే కదా, ఇంప్రూవ్మెంట్ ఏం లేదు కదా.
Yeah, that is there. Every treatment has a advantage and disadvantage. The CPAP advantage is it is non-invasive, means you are not undergoing a knife. There is no surgery, no risk, and it is successful. Mostly it is successful. Disadvantage is, yes, you have to use the machine
every day.
Every day. So I see, as a doctor, our duty is to provide the information. Nowadays the patient or the clientele, especially who comes to me practicing in a high-tech city area, most of the people are well educated. They also do their ground research. So my job is to provide them all the options. Look, these all options are there, and to motivate them that you should not neglect this. If you neglect snoring, bad kind of snoring or obstructive sleep apnea, there is increased chance of sudden death in the middle of the night. Sudden cardiac arrest. We hear that somebody died middle of the night suddenly. Sudden stroke happened middle of the night. It has been found many of them, 60 to 70% of them had suffering from obstructive sleep apnea, not diagnosed, not treated. So I take this as my first duty to spread the information in the society that don't take it casually. OSA can be a slow killer, so get it treated, whether by CPAP or by doing exercise or by surgery. That depends on individual choice and discussion with the doctor, but you must end it. You must not leave with it.
సో గురక అనేది చాలా సీరియస్ ఇష్యూ, మనం అసలు కన్సిడర్ కూడా చెయ్యం. బట్ దేర్ ఆర్ మల్టిపుల్ డేంజరస్ health issues that can happen because of guruka.
You will be surprised to know when these pilots go for their registration or renewal of their the professional validation or certificate. In that, sleep study is mandatory. If a pilot is suffering from OSA or snoring and not treated, their registration gets cancelled. You know why? Because their attention will come down. If they are snoring, they will be feeling sleepy while
driving.
So it is so important that army men, drivers, pilots, they get checked for sleep apnea.
Okay. అయితే లాస్ట్ వన్ క్వశ్చన్ డాక్టర్ గారు, అంటే గురక గురించి, గురక అనేది ఇంత సీరియస్ ఇష్యూ అని ఇప్పటి వరకు నాకైతే తెలీదు. సో మీరైతే ఆప్షన్స్ కూడా ఇచ్చారు. సో ఏదైతే ఇప్పుడు ప్రాణాయామ, బ్రీతింగ్ ఎక్సర్సైజెస్ ఉన్నాయో, వీటి ద్వారా మనం గురకని తగ్గించుకోవచ్చు.
It definitely helps, but it depends on how severe you have the snoring. So when a patient comes with snoring or sleep apnea treatment, the first test we do is sleep study. There is a test which is done when the person is sleeping.
What? మీ దగ్గరికి వచ్చాక
okay, not here. So there are two options to do sleep study. There are sleep labs. Some hospitals have a sleep lab, or it can be done home sleep study. Many of my patient wants home sleep study because they want to sleep in their own bedroom, in their comfort zone.
Correct.
So what I do, I send the sleep technician their home. So they have some small attachment, one here, one in the nose, one belt. With this attachment, you have to sleep, nothing else. And this machine, throughout the night, it will detect lot of information about your sleep. Next day, the technician comes home, remove the machine, and from the chip, they generate the report through the software. And there are specialists to read those graph and give the report. In that report, what we see that did the person snore all throughout the night or only few hours? Yes. What was the decibel of snoring? How many times apnea happened, that complete choking? How much oxygen saturation drop down has happened? So suppose if I see there was no apnea and oxygen has been maintained well, always 95, 96, then that snoring is not so bad.
Okay.
A little bit of weight reduction, pranayam, it will be cured. But there are people where every hour, suppose 15 times, 20 times, the person is choking.
Which is dangerous.
And the oxygen is coming down up to the level of 80, 70, 60, which is very high. So these are high level of obstructive sleep apnea. In those cases, only pranayam, only exercise will not help. With that they need a doctor's advice and another mode of treatment.
సో మీరు అన్నట్టుగా ఎవరైతే ఈ స్లీప్ ట్రీట్మెంట్ చేయించుకోవాలి అనుకుంటున్నారో వాళ్ళు, నేను కూడా చూసాను మనకి సో మెనీ యాప్స్ ఆల్సో కమింగ్, రైట్? సో అలాంటి యాప్స్ ద్వారా మనం స్లీప్ టెస్ట్ మనకి మనమే సెల్ఫ్ స్లీప్ టెస్ట్ చేసుకోవచ్చా? ఇస్ ఇట్ యాక్యురేట్?
Not always. iPhone and different phones you are talking about, probably yes they have app. Maybe I would not say negative about them, because some patient comes to me seeing the app is showing something wrong.
Okay.
So that is giving rise to some kind of consciousness to the patient that you go to doctor, you meet something is wrong, but while doing treatment we have to go through the proper sleep study.
Yes, correct. వండర్ఫుల్లీ ఇన్ఫర్మేషన్ మాకు ఇచ్చారు డాక్టర్ గారు. అంటే ఇంతవరకు నాకు పర్సనల్ గా కూడా తెలియదు. సో చాలా మంది వ్యూవర్స్ కి కూడా ఇది నిజంగానే ఐ ఓపెనింగ్ ఇంటర్వ్యూ అవుతుంది. సో డెఫినెట్ గా ఎవరైతే గురుకతో బాధపడుతున్నారో, ఇబ్బంది పడుతున్నారో వాళ్ళకి సిమ్టమ్స్ మనకి లేచిన తర్వాత తెలుస్తాయి. అండ్ డెఫినెట్లీ అది డేంజరస్ కాబట్టి ఇమీడియట్ గా డాక్టర్ దగ్గరికి వెళ్ళండి. అండ్ you have given us wonderful information and wonderful interview. I would really like to thank you so much. Thanks a lot.